heart is the most important organ in your body, as evidenced by the fact that it is the last organ to go if your body has a choice. It'll shut down everything else, including the brain, before the heart. So to introduce the heart, first we should talk about the exchange of gases, right? So it's really an exchange between the lungs and all of your cells or tissues, right? So as I put up here, oxygen is delivered to the cells and carbon dioxide is delivered back to the lungs where you breathe it out. Okay, so simple enough. So that does not use, for the most part, that does not use the same blood. There are different blood vessels that carry blood that has a lot of oxygen and blood that does not have so much oxygen in it, right? And here I'm calling it oxygenated blood and deoxygenated blood. But maybe a more apt term would be oxygen-rich blood and oxygen-poor blood. But in any event, they use different blood vessels, right? So I have oxygenated blood coming from my heart, around my shoulder, down my arm, and it's feeding all the cells of my arm and hand with oxygen, right? And so those are going down arteries, and then veins are coming back up, back around my shoulder, back down to the heart. That's carrying deoxygenated blood. So you've got two different types of blood vessels in your arm, in your body, carrying two different types of blood. So that's probably the best way to look at it. You can see your veins. You can't really see the arteries. The arteries are hidden. They're down a little deeper, protected. But so where does the heart come into this? The heart is the mediator. So really it's the heart saying, okay, lungs, give me oxygenated blood. I will take that oxygenated blood and I will deliver it to all the cells in the body. And then the heart is telling the cells, okay, when you're done with that blood, don't give it to the lungs, give it back to me. I'll give it to the lungs, and when the lungs give the oxygenated blood back to me, I'll give it back to you again, right? So this would be a little bit more fitting, the way I drew the arrows here. So there's blood going into the left side of the heart, and there's blood going into the right side of the heart. So there's two different types of blood going into the heart at the same time. This is the photo of the heart. It's a coronal or frontal section, so you can see inside. And the first thing that you could that we can discern is that there's a left side and a right side of the heart. And so the left side of the heart, and remember when you're looking at the heart or another organ, it's using the anatomical position. It's as if that heart is facing you. So this is the left side where the oxygen-rich or oxygenated blood is, and then this is the right side. And they've kind of color-coded it. You see how the right side's blue and the left side is like red, and that's supposed to denote oxygenated versus deoxygenated blood. But in any event, the left side only deals with oxygenated blood, and the right side only deals with deoxygenated blood, at least after you're born. So they don't mix the blood. What comes in the right side leaves the right side. What comes in the left side leaves the left side. So we've got two sides of the heart, right side and left side. Then we can divide it again because you have two parts, two chambers of the heart that only receive blood, and then you have two parts of the heart that only ship blood out, that only eject the blood. So you've got the two atria, they're like the receiving department, and you have the two ventricles, they are the shipping department, and so that gives us the four ventricle heart. So as you look here, right atrium, right ventricle, left ventricle. So the atrium receives blood, and you can kind of see where they're receiving them already. If you follow the arrows going into the right atrium, and you can follow arrows going into the left atrium. So looking at the right atrium, you've got all the blood returning from your body. We call that systemic circulation, right? It's all the veins in your legs, the veins in your arms. So like this vein in my arm is coming up, it's going around my shoulder, and then right here is the superior vena cava. So all the veins in your body all converge into either the superior vena cava or the inferior vena cava, depending on if it's above your heart or below your heart. Superior vena cava is draining your arms, your neck, your head. The inferior vena cava is draining everything below your heart. Right, so that all goes into the right atrium. And then that blood from the right atrium is going to be passed to the right ventricle. And then the right ventricle is going to ship it out, send it out, and it's going, as you see I wrote here, to the lungs. Right, so it came in from the cells as deoxygenated blood, and now the heart is going to send that deoxygenated blood out to the lungs, and it's going to get oxygenated. So the left side, this is blood now coming back from the lungs. It had been sent out to the lungs through the pulmonary arteries, which on this photo is purple. Some in the book it might be like blue, but it's been sent out to the pulmonary artery. It got oxygenated, and now it's coming back to the pulmonary vein. You could see the two pulmonary veins on the left side, how they're kind of going into the left atrium. What you cannot see, see like these are two openings for the pulmonary veins on the left side. There's also two openings from these two. So these two pulmonary veins are coming behind the heart, and there's two holes back here that are kind of hidden, right? So all four pulmonary veins all go into the left atrium. So normally we think of veins as being something that carry deoxygenated blood and are blue. And the colors, they're not exactly blue, but whatever, we're going to call them that, right? And then the arteries carry oxygenated blood and they're red. That's not exactly correct. An artery is something that takes blood away from the heart, and a vein is something that's bringing blood toward the heart. So it's all about the direction that the blood's flowing. Is it flowing to the heart, or is it flowing away from the heart? So when you look at the pulmonary artery and the pulmonary veins, it's reversed as far as like the colors, right? This is more of a, well, it's kind of purple, but in most books it's blue. And in this, they're not putting it really red, but it's more of a reddish color than it is like a bluish color, right? In books, it's going to be more, it's going to be blue and red, right? So even though it would be blue and it's carrying deoxygenated blood, it's an artery because it's going away from the heart. It's going to the lungs. And even though the pulmonary veins are veins, but they're carrying oxygenated blood and they're going toward the heart, which is why we call them a vein. So the only thing, as far as like the large parts of the heart here that we're missing is talk of the valves, and there's 4 valves. And so between the atrium and the ventricle, there's a valve, right? And they're marked here: tricuspid valve, mitral valve. So together we call these AV valves, atrioventricular, right? So they're between the atrium and the ventricle, so AV. So both of these AV valves, they function to keep blood from going back into the atrium. So once blood leaves the atrium and once it goes into the ventricle, it cannot return. You don't want it to return. And also, when blood leaves the ventricle and exits the heart, you don't want it to come back into the heart again. So that's what these valves do. So think of like, like doors, right? The door to your room, it opens into your room, but it doesn't swing back out into the hallway, right? It stops, right? So it just opens one way and it won't open into the other room. So that's kind of how these valves are set up. Now, if you look here between the atrium and the ventricle at this mitral valve, sometimes they call it bicuspid valve. you see these lines, like these stringy cords that it looks like they're pulling the valve open. They're not actually pulling it open. What those do, and they're called chordae tendineae. Don't worry about that for now. But what they do is when the valve opens into the ventricle, it prevents them from swinging back into the atrium again. So when those valves close, you want to have them close like that. And so the cords that are attached to it, they prevent it from swinging the other way. So these are actually loose right now because this valve's open. When this valve is closed, these cords are taut. So these two are the AV valves, tricuspid valve, mitral valve, and then these two are called semilunar valves. And that's when I'm referring to them together. But if I refer to them separately, they're named after the vessel that they're going to go into. So the valves, this is called a pulmonary valve because it's going into the pulmonary trunk. This is called the aortic valve because the blood's going to go into the aorta. So that's it. And their function is to prevent the blood from going back into the ventricle once it has left the heart. So 4 chambers, 4 valves. You have a few big vessels out here, the vena cava, inferior, superior, the aorta, pulmonary trunk with the pulmonary arteries, and pulmonary veins. So you've got 4 valves, 4 chambers, and 4 big blood vessels. So I'm going to stop this one about here. And if y'all have any questions, just let me know.